And Dr. Anthony Gonzalez here with Miami Community Health. We're here again to talk about another health important topic for you today. We're talking about men's health. And we have a good friend of mine, Dr. Rudy Eberwein, with us today. Welcome, Rudy.
Hey, how's it going, Tony?
I'm
Good
doing
to
great.
see you, man. So excited to be here.
Wow, great to see Rudy again. Rudy and I go back a long way from our days at Baptist, working in the hospital. Rudy has transitioned to a new life in medicine. We're going to talk about that new life a little bit. So, Rudy, just tell our guests, I know everything about Rudy because, of course, we have some similar origins, but tell everybody a little bit about yourself and what you do.
Very good, man. So, internal medicine. So we worked together at Baptist. I was a hospitalist, seeing so many patients at this time. This was crazy, grueling work, but I loved it. But this was acute medicine. So I'm lucky I was able to transition from this acute medicine to now preventive medicine. So I started a weight loss clinic called A New You Wellness 16 years ago. And, we were doing amazing. We were helping people lose weight. We were helping them not go to the hospital. So it was a big change. But what I noticed, the more I was doing weight loss, I would see some patients sometimes would get stuck. No matter what they would do, they couldn't get to the next level, especially as they aged. And that's when I went into the world of hormone replacement, hormone optimization. This opened up my world. We didn't learn anything about hormones. What do we know about testosterone from med
Bad
school?
stuff, all bad, right?
This is old school thinking. So I had to go against my old school thinking about my bias about what we studied and really learn how to apply therapeutic testosterone as part of a tool to help men feel better. And let me tell you, I'm not just the doctor, I'm also a patient.
Wow. So we're supposed to see a picture here soon of Rudy. And whenever we have that picture, we'll pop it up. But what we're going to talk about, obviously, is one of the biggest topics is testosterone replacement and whether it is beneficial or not. And what I've learned and what I've taught our viewers here throughout the years that we've been here on this show is that prevention is better. Prevention is much better than having a disease. So many of the physicians here have come along and told us if this is the way to prevent this condition. And so what Rudy is doing for us, and he's called Dr. Rudy, what Dr. Rudy is doing for us is he's helping us prevent. So let's get right into it. There was, in preparation of the show, Dr. Rudy sent me a Mayo Clinic publication and recommendations on testosterone. And like you said, it was so bad. We learned that testosterone is so bad for us. Tell us, how come it's not bad for us?
So like every medication, it has benefits and it has side effects, but we can mitigate the side effects. And if you use it as a tool in combination of all the lifestyle changes we know we got to do, nutrition, diet, mindset. If you use testosterone, if you need it in combination of all this, that's when you do well. Wow. So for me, what's important? Testosterone, again, I have this, I called it testosterone phobia, T phobia, and that exists because all of us who are trained that testosterone causes prostate cancer and will give you a heart attack. You should see the amount of studies that are coming out and showing positive results to the point that in 2018, there was an international consensus of 18 experts. That was, it was published in the Mayo Clinic Proceedings. That's a pretty good magazine, right? Yeah. So they came up with 10 statements about testosterone. And it was unanimous, 18, and it was led by Dr. Abraham Morgenthaler out of Harvard, and they published that in the Mayo Clinic. And the 10 statements, one of the most important ones was testosterone deficiency is real. There's real symptoms. It is safe. There's no link to prostate cancer. The evidence about heart disease is still kind of not definite. There were 2 studies in 2013 that showed a possible increase in heart disease with testosterone. But since then, more than 50 studies are actually showing you the opposite. And when you think about testosterone and testosterone deficiency as we age, it makes sense that it increases our risk of chronic disease because with low T, what do you get? Increased belly fat, decreased muscle mass. What does that do? Increased risk of diabetes, increased risk of cardiovascular disease.
So we're talking about men's health, and we obviously want our men to be healthy. What is the first step? I'm a listener. I'm a participant. What is the first step to know whether I need testosterone replacement or supplementation, let's call it? And is it safe for me? What is the first step? What does a viewer do?
So that's the best question. And for me, I always ask myself that. And the first thing you need to do is do an honest self-assessment with yourself. How are you feeling? So when I talk to my patient now, because I can do it, it's not through insurance, I take time with my patient. So I rediscovered the art and the pleasure of medicine. So when I sit down with one of my patients, a lot of my patients would have gone to their primary. They're like, I passed with flying colors. Maybe my cholesterol is a little high and my vitamin D is low. Besides that, everything's good. And I'm like, okay, and how do you feel? They're like, I feel good. No, I'm like, really? How do you feel? They're like, ooh, doc, I'm tired. I don't feel like doing anything. I go home, all I want to do is sleep. My mind, I'm not as sharp as before. My memory is going down. They're like, oh, really? All this? Did you tell your doc? Yeah, but they tell I'm stressed. They told me take a vacation.
You're getting old.
You're getting old. What is old? We are as strong as our hormones. Our hormones are our weakest link. As we get older, when you say you're getting old and grumpy, you know what it is? Your hormones are not getting as good. So when patients come to me, so yes, you may not have those severe symptoms, but you know what? Quality of life is important.
Very important.
Did you know that testosterone also binds to the serotonin receptors and is one of the best treatments that you can do for anxiety and depression? There was an article in JAMA Psychiatry 3 years ago that showed that about 35% of patients with some kind of psychiatric symptoms also have testosterone insufficiency. And when I say that, low testosterone, American Neurological Association defines it as a level less than 300. It's a very arbitrary number. So 300 to 1200 is the normal range. So if you come to me, you have 310 and you have all the symptoms, you're kind of low, but you're normal. I cannot help you. If you're 298, yes, I can help you. This is so unfair to our patients who have those symptoms. They don't know where to turn. And you know, when they go to a primary doc and they tell that, where did they turn? They go online, they look for a TRT clinic. Wow. Most of them may do a good job. I know I'm doing an amazing job, but a lot of them may not be doing the real job. I really feel that this low T epidemic that we have should not be managed by low T clinics. It should be managed by universities. There should be more research to be done about this. And talking about this, I have a great friend, Dr. Ramasamy at University of Miami. He just did 2 amazing articles. One of them is that adolescents and young adult males, 18 to 35, 20 to 25% incidence of low T. I have patients at 25, 30 with low testosterone, true low testosterone.
Below 300.
Not only this, and he did another study that showed that younger guys actually have symptoms of low T with a testosterone around 400. So the numbers don't mean much, anything, right? But in the how you feel. And the symptoms that is most common, low energy, no motivation, tired all the time, low libido, decreased sex drive. When a guy feels like this, what does he do? He usually doesn't have somebody he can talk to. He internalizes it. He has shame about it. He lashes out again about it, and he cannot find help.
Wow.
That's what I do to help people.
No, that's incredible. So, I mean, I actually, though I miss you at the hospital, I'm glad you're out of the hospital because actually you're helping people in an area where others have not ventured. You know, this is really a groundbreaking area. So the viewer, you know, just because you may be seeing your primary physician, you have a level of 400 or 500 that's quote unquote normal. If you're having these symptoms of low energy and no drive, and even the psychiatric problems and the depression and everything else, that's interesting information. Now, obviously health, and we talked a little bit about this. Visceral body fat, obviously, and we were talking about this before off camera. Visceral body fat has an impact. Tell our viewers, what is visceral body fat and how does that impact your health as well?
Definitely. So I've had this weight loss clinic for 16 years and we're doing really well with it. And the one thing I've learned throughout all this time, it's not your weight. It's not your BMI. What's more important is your VAT, your visceral adipose tissue. This is what increases your risk of diabetes. This is what increases your risk of cardiovascular disease, even of mortality. When we get older, what happens? You get more belly fat and you get sarcopenia, decreased muscle mass. Those are the 2 things that are more important as we age to maintain our muscle mass and keep our belly fat low.
So how can you help somebody who has, I'm 50 years old, 55, now I started having some more belly fat. What do we do?
So again, to go back to your question, what should you do? The first thing is honest self-assessment. How am I doing in life? How's my energy? How's my motivation? How's my relationship? Am I old and grumpy or am I vibrant and healthy? And if you start seeing, I'm more on the old and grumpy side, start digging. Go to your primary, do blood test. If you don't have an answer there, start looking. I consider myself a biohacker. You know what a biohacker is?
No, what is that?
So what we do, I try to leverage any natural resources, dieting, fasting, exercise, technology to make myself better. Because if I can improve my biology, my physical, my psychology will improve.
Yeah, we'll follow. Right. So obviously the visceral body fat, and how do you handle that visceral body fat? Is that with the combination of the dieting and the exercise and so forth? What would they get, when people come and see you?
So again, if we have the before and after. So of course, nutrition is the low hanging fruit of wellness. We need to eat better. And look at this. So this first picture, it was me in January 2nd. So I bought this new technology. It's called M-Sculpt Neo. So it is a machine. It's the Tesla coil that you apply to your stomach, and it gives you 20,000 contraction in 30 minutes. It's like you go to the gym and you do 20,000 sit-ups. When was the last time you did 20,000 sit-ups?
No,
I've never done it.
Yeah, no way.
But this machine, you sit down on it, you're relaxing, and you do 20,000 sit-ups. So this is me. So this was me in January, because I knew I was getting the machine. I'm like, let me see if I can get VAT, not fat. I got VAT. You see that belly?
Yeah, that's
that was
nice.
6 weeks of eating Popeye's fried chicken, eating cake, and having fun.
Well,
in
I'm gonna go next week for sure. That is crazy.
So, and it is not just one machine. It's not just testosterone.
No,
it is when
program.
you come. It's a holistic program where I sit down with each individual patient and we come up with what is best for you.
All right. So we talked about the testosterone. Obviously, it's safe in the right hands. We have all these, muscle heads that are doing that stuff in the gym, and we don't have physicians. Remember, Dr. Rudy is a physician. He's an MD, went to medical school, residency, practiced, medicine. We've been in practice 30 years of doing this stuff. So it's crazy that we're that young, right? But testosterone is safe. So you can use testosterone in the right hands, be evaluated completely in a holistic fashion, deal with the visceral body fat. Now, talk to me about the new you, because if you're up to something, I know there's got to be something different. And now you have a book coming out, and you're really, revigorating the man. Tell us about what's happening with that.
Well, so between my clinic, A New You Wellness, my testosterone clinic, Medical Health Institute, and we're introducing a new program, Total Body Transformation Protocol. This is where you would come in and I help you with your nutrition. I help you with your hormone balance if you need it. And then I help you with your exercise. Of course, I'm going to push you to exercise, but this is when we can leverage technology with the M-Sculpt Neo. I have another technology, red light therapy, that also helps decrease fat. And, the thing is, are those therapies perfect? Are those, they're not. But once you add this to nutrition, to this, to mindset, and you put all of this, the sum total, you will get results. And we get results for our patients.
Wow. And what about the book you're going to be putting? Tell us a little bit about the book that's coming out as well.
So the book I'm coming out is going to be called Low T Generation, because what's happening, again, citing that study, I used to, when I started doing testosterone replacement, most of my patients were 45 and up. Now, 30% of my patients are less than 40. Actually, there's an amazing article on Men's Health magazine in January that talks about this. Do you need more testosterone in your life? They talk about 35-year-old CEOs, Wall Street guys who have low T, and they had to go and do the research and really see that, man, I need this. So for me, it is something that we need to talk about more. And what I'm going to talk a lot about in the book, I've never heard people talk about this much, is why are we seeing so much low testosterone? Endocrine disrupting chemicals, endocrine disruptors, pesticides, plasticizers, chemicals we put on our skin, sunblock, all of those, really, they are anti-testosterone type chemicals. So it's been proven, we have an infertility crisis also in our country
of course,
now.
Yeah.
And there's an amazing book by a PhD, Shauna Swan, called Countdown. I would really encourage everybody to read that, because it really shows you all those IVF clinics popping up everywhere. There is a reason for it. It's not that we're just more stressed that this is happening. Chemicals are killing us. Atrazine, DDT, forever chemicals, Roundup, glyphosate, all of those things. Do you know it's 80 million tons of atrazine? It's a pesticide. 120 million tons of glyphosate every year that's being dumped in our environment. So we're living right now in an experiment where companies are just dumping all of those unproven chemicals. And then we wonder, why are we seeing so much ADD, so much cancer, especially hormonal type cancer, so much obesity, so much infertility. And now my book is going to link that to low T.
Wow. So the idea is we can't control the industries that are dumping all these chemicals on us. And what you're saying that obviously that leads to the low testosterone. And obviously that's why you have to get this more holistic approach. So let's talk about, in the testosterone world, the consequences, medical consequences of low testosterone. If somebody has that low testosterone, whether it be really low at 200 or 300 or functionally low at 400 or 500, what are the medical issues that we could prevent in a man, by getting some hormone replacement?
Definitely. So when it comes to symptoms, just like everything in medicine, it's a spectrum. So the symptoms guys tend to suffer from, it's low energy is a big one, low libido, decreased erection prowess. I don't call it erectile dysfunction. I call it erectile problems. And it may be that you're like, oh, I got a miss today. Every guy deals with those as we get older. But in our mind, we think testosterone is just muscles and sex. So yes, it could be libido. It could be erectile problems. But I have a lot of patients, they tell me, I have no problems there. Or maybe I don't have the desire, but if I want to, I could. It's the other symptoms, the anxiety, the increased belly fat, the no motivation. That's a big one. As we get older, you just want to sit down. No, yeah. I'm 50 years old. I'm doing a hashtag. 50 is the new 30, baby.
That's it.
50 is the new 30, right?
I got to follow that one for sure. And then obviously the visceral body fat leads to like the metabolic syndrome and leads to the diabetes, the hypercholesterolemia, the heart disease, and obviously it's a trickle effect.
So the studies are very strong that there's a bidirectional influence of testosterone in diabetes. So low T has a high incidence of causing diabetes or metabolic syndrome. And metabolic syndrome of diabetes, when you check the patient's testosterone, most of them have low T. So I see that all the time. I actually just had a patient, A1C of 11, he's not compliant. They keep telling him, go to the gym. He has no energy to go to the gym. His testosterone was 280. But everybody else like, well, lose weight and your testosterone will go up. How is he going to lose weight if he has no energy? So what I do, so I'm going to tell you my best treatment for patients with diabetes, low T and metabolic syndrome. You do a combination of testosterone replacement with a GLP-1 agonist, like something like Ozempic by Durion. You are going to get amazing results with this. So my patients with diabetes, or to me, pre-diabetes is an emergency. You have an A1C of 5.9. I don't take it lightly. It's not, oh, just diet and come back in 6 months. No, we're going to get that now. Let's get your A1C to 4.8. Let's work on this. I'm not going to wait till your A1C is 6.4 or 7 to now be aggressive. So I'm all about prevention, and I'm all about start now.
Yeah, no, we've learned that multiple physicians have been on here and told us that prevention is the better thing. We talked about sunscreen. You talked about the dangers of sunscreen. If you use the correct sunscreen, you can prevent the skin cancers. And obviously prevention, no smoking, so you don't get lung cancer and things like that. So then obviously we want to talk about this Dr. Rudy, I know Rudy as Rudy and Rudy Eberwein, but now it's Dr. Rudy. And so talk to us about the new Instagram and the new online social profile that you're creating with regard to Dr. Rudy.
Again, we didn't grow up with social media. So this is something new for me. I'm trying to go into this. So I created a new social media, Dr. Rudy Best Life. Because what I want to do there, I was thinking, what should it be? I want to help people get to that best life. And best life is not a destination. It's a journey. It's a path. And I'm going to tell you, Tony.
It is different for every person.
And that's what I want to say. I found that path. And what I tell people, don't follow my path. I'm going to help you find your path. And you know how you find your path? You need to feel good. You need to feel confident. You need to have gratitude, love. The way we do this, first you have to feel better. If you're fat, depressed, no energy, it's hard for you to be a better person. Whereas if I make you vibrant, full of energy, you want to work out, you want to go out, you're going to be a much better person.
So you know what I'm worried about as I'm listening to you? Mm-hmm. What about all the women that are listening to us?
So
what is my wife going to say when I go see you?
So I have great news.
She's gonna come over and see you too.
but I have great news. In our practice, Medical Health Institute, we have a female phison that takes care of a female for bioidentical hormone replacement.
Okay.
I used to do it for women. I know how to do it, but I leave my partner to do this.
Okay.
But remember, the bioidentical hormone replacement is only a tool. What we really stress is better nutrition, exercise, and mindset. Then you add the hormones, if needed, as the top off.
Wow, great. So we talked about living the best life, and obviously it's your individual best life. So, obviously I think we have had some hard times in our surgical practice recently. We had one of our surgeons who passed, and we've seen some death and so forth, and it's been sad. So, more and more we've told people, you have to enjoy what you have, enjoy your family, enjoy your life. And if you're suffering at home and you're low self-esteem, depressed, no energy, or you have, you're obese and you don't want to go out, or you're popping medications because you're pre-diabetic, you have to obviously, change up your life so that you can feel better. So no doubt about it. So what are the things that you want to tell our guests as we begin to close our program? I've already understood that, every man, is there a man that should not come and see you?
Every man should at least get a baseline number. And again, ask yourself, how am I doing?
Okay.
Real question.
Okay.
And real answers.
So every man, we even have room for the women because Rudy's got the women covered as well. And obviously if you're suffering from any of this, I don't think it's a number. I think it's just overall. And I've always heard about this, outside of the parameters, but we're very conservative physicians, and we have been. I think you've finally moved over to the other area where you're looking at a more global picture and looking at the complete health. And it's like using more technology to help our patients as well.
Definitely. So if we take an example, I've studied a lot of endocrinology now because of testosterone, and we know endocrinology cannot be a numbers game. When it comes to thyroid, to testosterone, it's not, are you below that number or above? You have to look at clinical symptoms and in a range of numbers, because for all of those, there's also receptors. So you could have a high number of testosterone. There's a lot of studies now that show that testosterone receptor resistance, the same we have insulin resistance for diabetes. So this is not what's coming out.
So that for our viewers, you can have normal level of insulin, but your cells are not responding. And what Dr. Rudy's trying to explain is that you could have a good level of testosterone, and your doctor can pick out that your testosterone is 500, but you don't have the receptors. Yeah. So what happens to those patients? How do you help them with the resistance?
Well, so again, first, belly fat is one of the biggest ones. So if you lose belly fat, a lot of times the number can go up. And talking about belly fat again, when that machine, and you saw my before and after, it's not just a look. So when you do my program, it's not just, maybe not everybody's going to get the six-pack. I have good genetics. I've always worked out my whole life. But the goal is to, even if you were to lose 2 or 3 inches off of your waist and you obtain a solid core, the core is at the base of every function of human needs. So if you have a strong core, you'll have less back pain. You'll be able to move better. You stand taller. Your shoulders go back. So your core makes you feel so much better. So with this new machine, that opened up a new one for me now. Again, I've seen my progression since I left the hospital. I went to weight loss, then hormones, and then now I'm leveraging technology. But one builds on top of the other.
Yeah, and I think technology is an important thing because nowadays in surgery, we've leveraged technology. And I tell people say, well, I want my surgery done open. I go, well, do you want a flip phone or do you want an iPhone, right? And, we have robotic surgery and the advancement of technology. Why not use that and so forth? And you've used that as well. And so do you also recommend some of the technological kind of apps and so forth?
Man, yeah. Yes, I have an Aura Ring to help with my sleep. I like my Apple Watch. I see all my energies that I'm doing. I'm all into meditation or connection. So I use different apps, I leverage technology. I do a lot of breathing work. So I use a lot of apps for breathing work. Do you know that there's a machine called Respirate that Medicare approved? And what it does, it helps you breathe slower. So you breathe about 4 a minute. If you do that 10 minutes a day, twice a day, actually Medicare will cover that machine. It decreases your blood pressure by about 10 points. Breath work. So when you have a patient who comes to you, their blood pressure is not enough. It's not always, let me add another medication. Maybe breath work is what they need.
So but see, regular doctors don't think of that. Our everyday internal medicine doctor, they just tell them, if it's borderline, lose some weight, cut out the salt, exercise. And if not, they put them on a medication.
We need a more holistic approach to health. It is difficult when you have to see 30 patients a day.
Yeah.
But we need a more holistic approach to health.
What you're going to get is different. And for our viewers understanding, you're going to get very personalized care from Dr. Rudy, and it's going to be individualized care. And that's why he wants to provide that more contoured care for you. And insurances are not going to cover for that.
They're
At
not.
the end of the day, they're not going to cover it.
And one thing, Tony, I want to say, I'm not here really just promoting my business. So for the listeners out there, whoever you go and do this with, doesn't matter. But you need to become the CMO of your own health. You
Chief
need to
Medical
take
Officer.
of your own health.
Yeah.
You need to educate yourself, know where you are, talk to different doctors, find the one that works for you. Don't take no for an answer. Do your research. So I'm big on this. I empower my patients. I'm like, don't take my word for it. Here's some research. Talk to other people. And if we agree with it, let's work together.
Yeah, no, I tell my patients as well, listen, I have 10,000 patients. I can't remember. You're only worried about one person. So follow up on your labs. Call us next week. Are you going to call me, doctor, with my ultrasound result? No, I don't. It's you. You have to remember, call us. And nowadays, of course, people have access to their portals and everything else. There's ways to connect to us. But definitely, I agree with that comment that Dr. Rudy says. You have to take care of yourself. So we're going to share some of the information with regard to how to contact Dr. Rudy. If you want to get that personalized type of care, personalized health care, they're going to flash up that information. Remember, it's not only for the men, it's also for the women. We've learned today about testosterone, that it's not bad for you. Consensus statement out of the Mayo Clinic showing the benefits of testosterone. We learned about the dangers of visceral body fat. It's not only dangerous that you don't look beautiful if you have a belly, but it's also medically not good. We've learned about that as well. And we've learned about, obviously, taking care of yourself and living your best life. So, once again, Rudy, tell us some parting thoughts and what are some of the important things as they flash up your information there? What are some important things people need to remember as they leave our show?
Well, again, I'm going to keep pointing that. The first thing is self-assessment. Second thing is, how do you avoid a lot of this negativity that's around us? Protect yourself. How do you avoid toxins? And how do you make your health the best that you can be? And to me, that's always this. It is a very personalized approach because it cannot be a cookbook recipe because everybody's different. So do your self-assessment, find the person that can help you, get a goal, get to it, and get another goal.
Wow. Rudy, man, I'm glad to see you again. First, personally, because, Rudy and I have the same background.
Yes, sir.
We're from the second best country in the world. Second best country. USA is number one, but we have the Haitian background. And so it's great to see Rudy, but also great to see about the new things you're doing that actually would be great for me and for my friends and so forth. So I'll be the first one to come and see you. And thank you for the information. We've learned a lot about the safety of testosterone and the dangers of visceral belly body fat. And so obviously, as it is a health show, we want patients to be healthy. Obviously, thank you for showing us what great health is.
My pleasure. This was great.
Great. Well, Dr. Anthony Gonzalez with Dr. Rudy, signing off from Miami Community Health. Thank you for being with us again.